part of the problem here is that, you've got to try and persuade a jury to let a man who has killed 12 other people and seriously injured 72 others walk out of jail, walk out of the court a free man. You know, that's not something a jury are going to be able to do in a hurry. You've got to persuade the jury that FDA knew these drugs could do it. You've got to persuade a jury that Pfizer knew that this drug Zoloft could do it because they'd given it to healthy volunteers 10 years before the drug came on the market for people who are depressed and shown the same things happening in healthy volunteers and written at the bottom, our drug can cause this. So, and you've got all these articles in the New England Journal of Medicine and JAMA which say this drug works wonderfully well and is free of problems. Can you persuade a jury to tear up their view of the universe,
Right.
everything that they've trusted up to this, to destroy the Bible? You're not going to be able to do that in a hurry, particularly if you're a public defender.
Right.
So my hunch is that they came to an agreement with the legal team for Pfizer on the other side that
Huh.
we would ensure this guy doesn't get executed.
Wow.
So I can tell you about that. I mean, with all the other guys who are dead, we really can't know for sure. You may know that they're on a drug, you may know that they're on a drug that can
Yeah.
cause this kind of
Well,
thing.
but okay,
But
but we
as you
have
get to interview the person,
yeah.
I don't,
We've got
you
this
know,
one case where the shooter survives. You personally were involved and you sort of saw the whole thing from the inside out. And that's what you just told us. We've got all these other cases where we can't do that because the shooter was killed. But, if we start to think more generally about how common things like suicide and suicidal ideation are with SSRIs, can you give us just sort of the basic lay of the land there? Is this a very common side effect?
yeah, in the healthy volunteer trial that we did, that I did, 1 in 10 of the volunteers became suicidal on an SSRI.
I mean, that's a big effect. 1 in 10 become suicidal, and
Yeah.
these are otherwise
Now,
healthy people.
yes. Now, a lot of people, when this happens, have the wit to stop. And the curious
Right.
thing about it all is that you've got some antihistamines which are available over the counter, which are potent SSRIs and can cause you to become agitated and have withdrawal effects and all the problems SSRIs can cause,
Really?
but are
Like over the
safer to
counter
take.
antihistamines?
Yes,
Like
totally.
what? Like Zyrtec?
Chlorpheniramine, for instance. I'm not
Okay.
sure what the trade name in the United States. Diphenhydramine, Benadryl.
Yeah, yeah.
Yeah. So I mean, what happens when it's over the counter? If you go and get this over the counter, I mean, you're not getting it as an SSRI or as an antidepressant, but if you get this drug and take it and it doesn't suit you, what do? You stop it. You're
Right.
not inhibited by your doctor who keeps saying, oh no, you need to keep
Yeah,
taking it
yeah,
for
yeah.
6 weeks before we stop it?
Right.
So part of the problem isn't just the drug, it's the fact that you can only get it through your doctor, and he's been educated by the New England Journal of Medicine, ghostwritten fraudulent articles to think that there are no problems with these things. And if you're complaining, you're just an anecdote, and this is all in your mind. In fact, you're more seriously than we thought you were. So,
Well, I mean, I want to thank you for your time because we've already talked a little bit longer than our schedule, but this is obviously a big topic. This touches a lot of people because these things are prescribed to so many people that, if you're not on one or have been on one yourself, you certainly know people who have been. Any final thoughts or major takeaways you want to leave people with about this general subject of SSRIs and the whole enterprise of psychiatric medicine today?
yeah, first of all, it's there are a lot of people who can be helped by SSRIs, and as I've indicated, I don't not prescribe them. Um, the issue isn't so much the pills per se, it's the way doctors have been manipulated and educated into using these pills, which is the harmful thing. Our medical journals have failed us. It's not so much the pills that are failing us. It's much more a case of the medical system, the doctors, our journals, and things like that. The professionalism that just isn't there. The willingness to stand up on behalf of the people that were treating, the people that we're making money out of, we're not doing it. We're not showing backbone. So the issue, it's a mistake. You're not going to solve the problem by just trying to get rid of pills. You've got to call on doctors to really
Hmm.
step up to the plate.
Hmm.
That's the key thing.
Hmm.
And it's not just the SSRI group of drugs, it's all drugs. It's the
Hmm.
statins, it's antibiotics, it's
Yeah.
every drug we use is, well, almost all the drugs we use are actually um, um, uh, affected in much the same ways. It's the
Yeah.
same
Yeah.
ghostwriting, it's the same hiding of the data,
Hmm.
and a bunch of problems that you're told, well, no, this is
Hmm.
this is all in your mind.
Is it for those of us that look at the literature directly or indirectly, we're reading clinical trials or reading about clinical trials? In your view, in terms of ghostwriting, industry bias, and things like that, when we read papers about these drug trials, should we assume they're innocent until proven guilty or guilty until proven innocent?
Yeah, I think you've got to recognize that, first of all, companies aren't doing trials to inform clinical practice.